everybody. We are going to be talking tonight about headaches and migraines, and I know that I just already talked about that a little while ago. So today I'm going to do it a little bit differently. I'm going to talk about my friend Esperanza. This is Esperanza. That means hope in Spanish. And so some of you know, anyway, hi, I'm Dr. Lisa Gordon. I'm here at the Natural Health Improvement Center of Columbia, Maryland. I'm a chiropractor. I've been in practice for 34 years, and I do nutrition response testing and chiropractic and neurocranial integration. So today I'm going to be talking about neurocranial integration and how the bones of the skull have often to do with headaches and all sorts of things. So this is what your skull looks like, and these bones in your skull actually are not completely fused. Many people think that they're completely fused and all of those things called sutures don't move at all. The truth is that on a cadaver, which is a dead body that is being studied by those of us who've done what we call gross anatomy, cut apart bodies in our anatomy classes, which I did in chiropractic school, which chiropractors do and medical doctors do. Those bones are actually fused because that person is dead. But in the live human, they actually move ever so slightly. So you can see these little places here. Those can move ever so slightly, and a skilled practitioner can feel that. So what happens when you get any kind of head trauma? Those bones can go out of place. Maybe you got hit on the head. Maybe you had a car accident and had a whiplash and that head went boom, like that. Yes, the neck gets affected and the head gets affected too. These bones can go out of alignment and never really go back into alignment. So the skilled practitioner of cranial work, I'm one of them, can actually get in there and move those bones around a little bit. And I'm going to show you what it looks like inside because it's really cool. It's a little tight here. Let me grab that. Okay, so this is the inside of your skull. So this is the top of your head. This is the front of your head, your forehead, and that's the back of your head, the top of the occiput. That's the purple part is the other part of the occiput. Your brain is inside here. This comes out. Your brain is inside there. This yellow one is the top of your sinuses. So on the bottom, it's the roof of your mouth along with these bones here that form the front of your face. So these bones can be affected by sinuses, or the sinuses can affect the bones. So oftentimes we will get in there and move things around on the inside of the mouth. There is a little gland here. The pituitary gland sits right up in there. That has to do with the top of your endocrine system. So sometimes with nutrition response testing, I find that the pituitary gland is affected nutritionally, and so we have to give the person some nutritional supplementation, but sometimes it's also, or instead of that, it could be that this bone called the sphenoid bone is out of alignment. So if that bone is out of alignment, then it can actually affect the endocrine system. So it can affect your pituitary, it can affect your thyroid, it can affect your adrenals, because all of those have to do with, it's all in one system. So there's a lot that goes on here. The jaw is also part of the skull. So this part right here is where the lower jaw attaches. I've had this for a really long time, and my children stretched out the spring, so I no longer have the lower jaw, so I can't show you. But anyway, that would be the lower teeth, and I just couldn't fix it. Anyway, so that's where the jaw is, and a lot of people have TMJ problems, temporomandibular joint dysfunction. So aligning the jaw, aligning the bones of the skull, you can see would be very important. So headaches are really complex, and they can have many, many different approaches. The other day, the reason I thought to tell you this stuff is because the other day I had a really big headache. I used to have bad headaches. I rarely get them anymore. But the other day I had one, and I thought, Is it allergies? Is it my sinuses? Is it the weather? All these things can cause headaches. And I think some of those things were going on. And I'm not one to take medicines, so I didn't take medicines. But instead, I started pushing around on the bones of my skull. And I realized if I push around on this bone here, which is this bone here, was overlapping the other one just ever so slightly. And so I messed around with it on my own head, and I was able to pull it in the right directions with my breath, as I would do with you if you came in and I checked you. And I found that to be the problem. And lo and behold, the headache went away. So I thought, I'm going to come and bring this to you guys. I know I did migraines and headaches just so recently. And I was telling my assistant, Gabby, the other day, well, I just did that. So how can I bring something new? So I'm bringing this to you today. And I love doing cranial work. It's so powerful. I can do cranial work that can affect the whole body because the tissue that goes around the brain and the spinal cord is affects all the whole rest of the body. So sometimes when you've been in my office and you find me pushing on the back of your neck, on the back of your head, I'm actually stretching that tissue that's around your brain and your spinal cord. And sometimes remember you felt it in your upper back or in your lower back. And even knees can be affected because this tissue turns into the stuff called fascia that's very popular. Fascia is very popular. It's the stuff that goes around the organs, it goes around the muscles, and so on. And if that gets little glitches in it, then you can have tension in other places. So it's really important for us to reduce the tension on that fascia. And one of the ways to do that is to make sure that the skull is in alignment. So that's what I've got for you today. If you want a free phone consultation with me, I'd love to talk with you. My number is 667-240-2923. And give me a call and we can chat and see if you're a good candidate for care in my office. I'd love to have you be functioning at your highest level, and I'd love to help you do that. All right, take care. Bye-bye.